Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over timing of wound hygiene and biofilm intervention strategies. But first, if you could hit that subscribe button, it would be greatly appreciated as it does help my channel reach more people. So let's get started, guys. So it's estimated that between 2 to 6 of the global population currently live with wounds, and this is actually expected to rise in the upcoming years as a lot of the population grows older. Now, wound hygiene promotes the healing of hard to heal wounds by assuming that biofilms are present in every wound and delays healing. Okay, hard to heal wounds are those that fail to respond to evidence-based standard of care. Okay, however, it is vital to understand that factors can also affect wounds. Okay, so location, underlying conditions, comorbidities, these can also be affecting and delaying wound healing. So we always have to assess that, and we always assess that right when we're our initial assessment of any wound. But if we've already looked at all of these, we can assume that biofilms are involved. Okay, so wound hygiene addresses early biofilm formation with the following strategies. So we want to clean the wound and surrounding wound, mechanical debridement, refashioning the wound edges, and biofilm targeted management and prevention. Okay, the 4 aspects of wound care listed above must be carried out regular and repeated throughout the wound's progression to wound healing. Okay, so this is something that you have to continuously do because biofilms do grow back very, very quickly. So why is wound hygiene so important? Okay, so the 4 steps that we had just talked about in the last slide, why are they so important? So acting quickly is imperative with wound hygiene as biofilms form and reform very rapidly. So biofilms are thought to be the primary cause of delayed wound healing. I've actually come across quite a few articles where doctors have said that they are the primary cause, that biofilms are the cause of chronic wounds. And nobody has really challenged that or gone against it. So it's kind of controversial, but they are thought to be a primary cause of delayed wound healing regardless. So for example, researchers have discovered that oral, so in your mouth, biofilms reform within 48 or reform within 24 hours of performing oral hygiene. And gingivitis can actually develop within 10 to 21 days. Okay, so wound biofilms are very similar to oral biofilms and can reform in hard to heal wounds within hours of disruption. Okay, so when you're disrupting the wound bed, getting rid of the biofilm, it can come back that quickly. It's not possible to make a definitive diagnosis in appearance alone, and you do need molecular biology and microscopic techniques. These are not always available and they are super expensive. So we can assume for all chronic wounds that there is a presence of a biofilm. Okay. The increased number and complexity of microbes in any tissue will heighten the risk of infection. This risk rises when we have antibiotic or antimicrobial resistance or tolerance, or if the patient's immune system is compromised. Okay, to support healing, the biofilm must be disrupted and removed. Okay, because the speed of biofilm formation, a wound with existing slough or exudate that shows an increase by the 3rd day of its occurrence, it can be defined as a hard to heal wound. Okay, so wound hygiene attempts to remove all or minimize any unwanted material on the wound, including biofilm, devitalized tissues, foreign debris, It addresses any residual biofilm and prevents its reformation to improve the healing environment. Okay, so that's what wound hygiene is really trying to do here. So when should staff begin the wound hygiene protocol? So once again, this is for hard to heal wounds. Okay, so once we're over the initial phase that somebody has gotten hurt, I mean, like, this is for hard to heal wounds. We don't just want to be using antimicrobials and things like that on just every wound. Okay, so this is for hard to heal wounds. Since clinicians should start the wound care with the assumption that biofilms is already present in a hard to heal wound, okay, they may begin the wound hygiene protocol without delay to minimize the chances of biofilm resulting in delayed wound healing. However, time is essential due to the speed of which biofilms can form and reform, as it forms within hours and reaches maturity within 48 to 72 hours. In fact, by the time that there's clinical signs of infection are present, the biofilm will already be mature. Okay, so I'm just going to go over the steps to consider, because really these are the intervention strategies that we will be using for the biofilm. So cleansing the wound and peri-wound area. This removes unwanted material and microbes to promote a balanced environment for wound healing. Okay, debriding the wound. So proactive debridement removes or minimizes all unwanted material to disrupt biofilm formation and reformation. Now, the type of debridement selected for initial or maintenance treatment should be selected only after the full wound assessment has been completed, because certain wound characteristics may support one type over another. Okay, refashioning the wound edges. So biofilms have been observed at the wound edges, and PCR examinations have consistently found the number of bacterial growth higher at the wound edges than in the center of the wound. So refashioning these wound edges to remove devitalized tissue, and biofilm can help promote the wound healing, letting it close in. Okay. Dressing the wound. So dressing the wound in an antimicrobial dressing can prevent the reformation, as the antimicrobials in the dressing will kill bacteria, preventing recolonization and biofilm formation. Okay. Now, once again, this is for hard to heal wounds. Okay. I wouldn't want anybody doing this on just an acute wound, something that's just happened that's going to close right away. Okay. So the benefits of wound hygiene may include lower rates of infection and chronic inflammation, higher and faster rates of healing. Both goals can lead to a better clinical outcome related to wound care and higher quality of life for the patient, which is our really number one, especially for patients with hard to heal wounds like these. Okay, regardless, a well-planned wound hygiene regimen is needed, and it removes some barriers that negatively impact wound healing so that the patient may have a better healing outcome. Recent literature challenges clinicians to evaluate the timing of various wound care interventions with an eye towards these barriers and encourage early intervention through an anti-biofilm paradigm. Okay, so that's exactly what we've gone over, those 4 steps. That's really an anti-biofilm paradigm, okay? So I hope this video did give you a better idea of how we can manage biofilms and what we should be doing for wound hygiene for those hard to heal wounds. But that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.